I'm Dr. Bob Harmon, Director of the Duval County Health Department.
All right, perfect. All right, Dr. Harmon, how is the bill going to save healthcare and cut costs in general?
Well, the purpose is to improve the quality of healthcare, increase coverage, and control costs. And there are more than 2,000 pages that get into the details of how it will try to do that. And a lot of new ideas are in the legislation, but a lot of the challenge is in the detail of how those will be implemented, enacted, and funded.
Okay. Why do Republicans want to repeal?
Well, they're concerned about several things. One is the cost. Will we be able to control the costs? Because the country has not done a very good job of that with other big health insurance programs like Medicare and Medicaid, which were enacted in the mid-1960s. So there's big concern about the cost. There's also concern about some of the mandates, the requirements in the legislation, in the act. Mainly the individual mandate, which would require essentially everyone to have some kind of health insurance by the year 2014. And then there's a mandate requirement that the states greatly expand their Medicaid programs. And again, that's a program with problems of cost containment and in some cases quality.
Exactly. All right. Why is Rick Scott refusing funding and saying Florida is not going to participate?
Okay, well, first of all, let me say I'm a state employee and I work for the governor. So,
this is true.
It's my understanding that Governor Scott is against the law, would like to repeal it because of some of the mandates in there and the cost concerns, and would like to start over again. And that is pretty much the position of the Republican Party and most of Republican candidates. So it's a very political issue.
Definitely. I mean, it makes sense since the whole Republican Party is going that way that he would feel the same. What's the bottom line reason for a need for healthcare reform? What's the biggest reason that this is coming about?
We have more than 40 million uninsured people in the United States. And most of the studies show that they don't get the kind of primary care and preventive services they should be getting to prevent any conditions from getting worse, like diabetes. Therefore, they tend to wait and go to the hospital, the emergency room, when things get really bad. That's a very expensive way to deal with health care. It's much better to do primary care and prevention. So if we had more people insured, they would have much better access to those early services and prevent the really expensive things, preventable hospitalizations, preventable emergency room visits. And around the world, our economic competitors, France, Germany, most of Europe, Japan, do have universal coverage, and they have less expensive health care and better quality results.
Do you think they have that universal coverage though because they're not exactly, their government isn't run the same way ours is?
They have different kinds of government. Most are democracies. Most of these programs were enacted decades ago. Germany was the first. However, there are some that are recent, such as South Korea and Switzerland. Only in the last decade or two enacted this. And in those countries, even the conservatives finally agreed that this had to be done for the greater good. There's a moral and ethical reason, and also to improve the quality and outcomes and get a handle on costs, because it's expensive to have people uninsured. There's a book about it. It's called The Healing of America by T.R. Reid. He's a journalist, and he's written about healthcare in those other competitor countries. He's been there, he's gotten care there, and he's compared that to the United States, including the provisions of the Affordable Care Act. And his conclusion is that universal coverage is needed in the United States sooner than later if we're going to ever keep up with those other competitor countries. This is a big burden on employers to have these escalating costs of their employer-based health insurance. So I think that book is recommended reading for people who are interested in this subject, and it's all over the internet. There are videos about it. There are summaries. It's a very good book.
Definitely. Sounds like something we're going to have to look into. Well, can you explain the political argument with the bill?
Well, the argument is that it's too complex. It could well be too expensive. It has these mandates in it, which are not popular. And so there's a big political battle going on over repeal of all or part of it. And then the funding, big argument about whether it should be funded piece by piece or not. And there's a big question whether it will be funded adequately. There's also a political debate going on about what's not in the bill. There isn't very much in there about tort reform or removing the medical liability issues that are expensive. So there are a lot of reasons why the bill should be amended or changed, and that will probably happen.
Where's the money? Where are they planning to get the money for all these changes?
Oh, there are a variety of things that will kick in eventually. There are penalties in it if you don't get health insurance or offer health insurance. There are taxes in it in the future, which are unpopular. But it generally is supposed to pay for itself as time goes on through new fees, penalties, taxes, and cost savings as we gradually, hopefully, get the costs of Medicare and Medicaid under control. But that has been hard to come by in the past, so that's a big question mark.
Well, it's all kind of a big question mark right
Right.
now. What exactly does this mean for Florida in particular?
For Florida, we're a big state. We have almost 19 million people in Florida. We're 6% of the United States population. We have probably the highest percentage of elderly of any state in the nation. And so as this affects Medicare, that'll be a very important subject. Plus we have a large Medicaid population, so another between 1 and 2 million Floridians will become eligible for Medicaid, and there's a challenge in controlling the costs and improving the quality of the Florida Medicaid program. So there's a proposal to go statewide Medicaid managed care already enacted, and that is controversial because those patients must choose a health plan. In Duval, we've already been doing that through part of a pilot, and it's controversial. My own view is it's going pretty well and will probably stand the test of time and will probably continue, and it may go statewide. We'll have to see what happens.